next thing we're going to show you is a stretch for the side of your hips and through here. The big problem with most modern lifestyles today is we don't move our hips enough. We don't do sassy hips to the side. We don't poop in the woods anymore. We do all these things that we limit our range of motion, and so we lose the ability to do some of those things, and we get pain in the side of the hips. We get pain with walking, pain with running, and this is a good way to loosen that up. So it's also a tricky stretch to do. So we need to line up some points there so that you emphasize your hips and not your spine, because sometimes people do this and they feel a little bit of bad stuff happening in their low back. So let's set this up. First of all, you're going to want to stand maybe 6 inches away from a door frame. So I don't have a door frame here. We're just going to use the wall. But the stretch side is the side that's away from the wall. And the first thing you want to do is all the weight's going in the stretch side. So my right side has got 90% of my weight. The other side just there for balance. I can have my foot here. I can have my foot there. It doesn't really matter where this foot is. It just needs to have balance. And then you got the wall here if you need it. So the first thing we're going to do is try and get the hip out to the side. And believe it or not, this is like one of the toughest things for people to get, because when you're tight in through here, people substitute and they do their low back. So they won't do this with their hip. They will do this with their spine. They don't bend here and they substitute their low back. And that is exactly why we want to do this stretch, is that if your hips are tight, you substitute your low back. Your low back gets beat up, it wears out, it hurts. So you want to take the stress off your low back by loosening up your hips. So again, we're thinking about the trunk like a box. So shoulders, hips, we're a big rectangle here. And as I go out to the side, I don't want to change that rectangle at all. My hips and my belt and my shoulders should stay more or less the same. So I'm not going to the side like this. I'm going to keep this box intact and go out to the side like this. The stretch here, the difficult thing for people is, how do we get the hips out to the side when it's so tight in through there? It might take you 5 or 10 repetitions out to the side to pry open the outside of that hip, because at first it's going to not let you go. And if you only go that far, that's fine. But you do need to start getting your hips out to the side. We think about the cue I give to patients like you're going to bump a car door shut with your hip. You want to get the hip out from the side by getting the hip out, not trunk over. So I'm not doing this to get to the side. I'm doing this. And so that's our first motion. Sassy hips out to the side. You're trying to get this hip out as far as you can. Once you've achieved that stretch out in through here, we're going to move the hips forward and back. So if I look from the side, what this is going to look like, I'm going out this way, and then I'm going forward, and I'm going back. How much? As much as feels good. I mean, don't overdo it, but we're going to do something different for the front of the hip, and we're going to do something different for the back of the hip, so we're thinking about this middle range in through here. When I'm doing this, my foot is also pivoting. You kind of can't see this, but when I go to the back, I'm rolling out onto my little toe, and when I go this way, I'm rolling onto my big toe. So it integrates some whole leg movements in through here, so rotating in and out. So we do maybe 5 or 10 of these, emphasizing this out to the side movement. The second thing we're going to do, back to the front so we can see what we're doing, we're out to the side and then we're going forward. So by going forward, I'm going to emphasize the front of this hip. And this is a really tight spot for most people. So you might find that you can get to here and you get like a painful thump, or like something shifts. And that's okay. Just don't go back and forth over that spot. Don't speed bump over it and make it worse. But if you can get out to that side and move out in through here, a lot of times people find that if they reach tall and create some length through the whole side of their body, it makes it a little bit easier to feel all this loosen up. But we should be feeling like front pants pocket range in through there. Again, when I go out to the side, I'm out in the 5th toe. And when I go in this way, I'm in on my 1st toe. So I'm rolling back and forth. And that rolling, again, is part of what we're trying to enhance. The hip is a ball and socket joint, so it needs to be able to move in all the different directions. Okay, third part, I'll show you from the side. We again go out to the side, and then we're going back. So I'm pushing my butt back and out this way. Again, I'm not compromising my spine. I'm keeping this box intact, but I'm going out to the side in through here, and then I might have to fish around for where that tight corner is, but I'm going diagonally back. I will oftentimes get people saying, I feel a lot of tension in through here where the glute max is attaching to your thigh. So you can take tension off that spot by bending your knee, scoot your hip out a little bit further, and then floss like this. So again, tension's on the hip, then straighten the knee, and you'll get that painful spot to loosen up. And again, kind of hunt for tension in through there on the side. Your body is not always going to go right to where the maximum tension is. It usually moves away from that tension. So you have to create tension and move so that you can enhance that ability to find that tight spot. And we didn't really talk about this, but the hip is a ball and socket joint. It sort of needs to be able to move in all these different directions. And so if we don't load and move, we're not going to get the hip to loosen up. You can do static stretches, but you're not going to get the hip to loosen up. So that's it. That's our standing hip stretch.